Is the skinny shot safe before surgery? Well, a variety of injections have been labeled the skinny shot, but what I'm referring to are GLP-1 inhibitors like semaglutides and tirzepatides. These classes of medications were initially approved by the FDA to help control diabetes, but now have found vast and widespread use for weight loss injections. Commonly used semaglutides include Ozempic and Wegovy. Mounjaro and Zepbound are popular tirzepatides. Both injections hormonally regulate appetite and blood sugar levels, slow down gastric emptying, and create a feeling of being full, which decreases caloric intake and encourages weight loss. These GLP-1 skinny shots have become very popular very fast. While the effects of GLP-1 medications on weight loss are well documented, the potential impact on surgery, wound healing, and post-surgical complication rates needs to be better studied. Dr. Wei-Chen Li and his research group at Galveston, Texas, recently published an article in the Aesthetic Surgery Journal on this very topic. This was a retrospective database study from 2021 to 2024, looking at patients who had undergone body contouring surgery after prior bariatric surgery. These are procedures like tummy tucks, thigh lifts, breast lifts, and gynecomastia surgery. Researchers used a propensity scoring system to include patients with similar risk factors. 4,157 patients received the semaglutide skinny shot within 6 months prior to surgery. An equal number of patients underwent similar surgeries, but without receiving any semaglutide shot prior. In this study, patients who had received prior semaglutide shots had a significantly higher risk of multiple postoperative complications. Wound healing complications, infections, bad scars, nausea and vomiting, and incisional pain were all statistically more common in patients who had prior received semaglutide shots before surgery. In some instances, the risk was more than doubled. Semaglutides like Ozempic and Wegovy create a net negative caloric intake, which causes the body to burn fat and potentially also break down muscle and go into a catabolic state. This can cause an increased risk for nutritional deficiency. The importance of nutrition with wound healing after surgery has been well studied and should not be overlooked. In order to optimize wound healing, I recommend that patients stop all semaglutides or the skinny shot at least 1 month prior to surgery and 1 month after. Furthermore, our board-certified anesthesiologists prefer to stop semaglutide shots prior to surgery because delayed gastric emptying can increase the risk of nausea, vomiting, aspiration, which can lead to pneumonia. Although many patients are very happy with their skinny shots, remember, safety first. It's important to discuss this and any other medications with your board-certified plastic surgeon prior to surgery.